Good afternoon, Brollies. Thank you for joining us this afternoon for our fourth webinar session in our course series. This is your first session. Special welcome to you. The series was put together to equip all of us with practical tools to deal with difficult times we may find ourselves in. One such a time is now, when we're presented with the choice to get vaccinated against COVID-19. However, to make the best choice for yourself and your loved ones, you should ideally have enough information so that we have clarity on all aspects regarding this decision. In today's session, we hope to get clear answers to some common questions and concerns that may have been on your minds regarding the vaccine. Which brings me to our speaker for today, Dr. Jenny Sapphire. Dr. Sapphire is an occupational medical practitioner and has been in the field of occupational health for the past 25 years. She currently works at Life Employee Health Solutions, where she has been for the past 21 years, working initially in the occupational health clinics and currently in the role of clinical standards manager. In her current position, she was responsible for quality assurance and compliance and provides a supportive and advisory role to key clients on occupational health related matters. She's a member of the SA Society of Occupational Medicine, SA Society of Travel Medicine, and a Mind Medical Professional Association. Dr. Sapphire is here today to really equip all of us with the facts around COVID-19 and share some information around the vaccine that'll empower you to make your own informed decision. Thank you, Dr. Sapphire. We look forward to hearing information that you have to share with us today. And I'm sure I speak for everyone when I say this is a much needed time for us to understand information like this. Thank you for affording us your time today, and over to you.
Thank you, Andile, and thank you to Brol for inviting me to give this session to you on vaccinations. This is a very important topic, and I'm going to share my screen so you can see what we are talking about today. So the topic today is vaccinations and the right to choose wisely.
Dr. Jenny, I'll let you know when we can see the screen. There's nothing up on my end yet.
Okay, apologies. Are you seeing the screen?
Yes, I can.
Right, thank you very much. Okay, so today the talk is on COVID-19 vaccinations and the right to choose wisely. And as Andile was saying, it's only with information that we can make our own choices and make the correct choice. I'll be talking for about 35 to 40 minutes. There will be time after that for questions and answers. So please, if you do have any questions, please post them in the chat box or the question and answer box, and we'll attend to them at the end of the session. If we don't get to all the questions, I'm happy to assist with questions emailed to me, and then I will provide the answer. So I'm going to go right ahead to start. This is the overview of the talk. I'm going to look at COVID-19, the current situation, what we know about the virus, some general information about COVID-19 vaccines, looking at the COVID-19 vaccine situation, looking at the rollout in South and Southern Africa, looking at the side effects and adverse effects, and then the impact of the COVID-19 program, both local and globally, and then also looking at misinformation. So as I said, we now, certainly in South Africa, we're in the height of, we're just over the tip of the third wave. And in the other African countries, we're experiencing increases and decreases in the amount of cases, of new cases of COVID. And we now need to decide, because we do have the rollout of vaccination programs, do we vaccinate or do we not vaccinate? So I think the two questions we need to address is, firstly, are the vaccines safe? And secondly, do they work? So just looking at South Africa, looking at the current stats, these are from yesterday, taken off the website southafricacoronavirus.co.za. Up till yesterday, we performed almost 15 million tests. We've had nearly 2.5 million positive cases. We have about 2.230871 recoveries. And very sadly, we've seen 72,000 deaths. This graph looks at the daily new confirmed cases And I've shown South Africa and a number of the countries in Africa, which some of you are working in at the moment. So you can see with South Africa, we've had 3 clear, huge waves. And now we're over the tip of the wave, and we're now coming down with a bit of an upswing. But hopefully the trend is generally on the downswing. With the other African countries, much fewer cases than South Africa, but still grumbling on. And then also looking in South Africa, although the wave is generally trending downwards, certainly in Gauteng looking much better, Western Cape is still on an upward trend, and KwaZulu-Natal still on an upward trend. So what do we know about the virus? So this is our virus, commonly known as a SARS-CoV-2, or severe acquired respiratory syndrome, CoV standing for coronavirus, and 2, it's our second virus that we've had in this family of coronavirus. Coronavirus is a family of viruses. They've been around for millions of years, and we've certainly had infections with coronaviruses prior to the SARS-CoV-2. And the disease that the coronavirus causes is COVID, standing for coronavirus disease, and it was discovered in 2019, so it gets a 19 attached to it. This is a graphical representation of the virus. It consists of an outer envelope, which is a fatty lipid layer, which is very soluble in soap or in alcohol or in bleach. And that contains the genetic material of the virus. On the outside, you've got these what are called spike proteins. And these spike proteins are actually responsible for the virus being able to enter our bodies and stick to our respiratory tract system and other organs and start to multiply and cause the havoc that it causes in our bodies and currently in this world. So why is this such a dangerous and deadly virus? SARS-CoV-2 is a novel or a new virus never detected in humans before December 2019. There is no immunity in the human populations across the world, meaning that every person is vulnerable to infection. The virus spreads fast and very easily between people. People may be infected and show no symptoms, and this allows for easy spread because they're not aware that they are spreading COVID. It causes severe illness and death in people with comorbidities, and these would include things like high blood pressure, asthma, diabetes, and people who have got risk factors, and those would be the elderly, the overweight, and women in their later stage of pregnancy. And now we're seeing that the virus is becoming less and less discriminating and affecting young, healthy people as well. It also affects multiple organs like the lungs, the blood vessels, the kidneys, the heart, the brain. In fact, there's not really an organ that it doesn't attack. And now we're dealing with a new entity, which is known as long COVID or post-acute COVID-19. And this is also causing, because COVID has only been around now for about 18 months or so, but we're seeing this entity of long COVID coming into the picture, which actually complicates everything. But I'll talk on that a bit later. And finally, we've now discovered that this virus mutates. But in fact, all viruses mutate. If they're allowed to duplicate or replicate in communities, they generally will mutate. And these mutations cause what we call variants. And we have variants of concern. And these are because these variants are causing reestablishment of waves. So what are the variants of concern we have at the moment? There are 4 main variants of concern in the world. And these are labeled initially according to the country that they were discovered in. They also have a scientific name, but for ease of referral, they now are referred to by a Greek alphabetical name. So the first one was Alpha, discovered in the United Kingdom. Secondly was our virus, the South African virus, which is given the title of Beta. Then this Gamma was found in Brazil, which we don't really have a lot of in this country. And now the very commonly known Delta virus, which started its life in India, caused major havoc in India a couple of months ago, and has spread to the rest of the world, and is really responsible for a lot of the increase in cases all over the world. So what do we know about the Delta variant? We know for one thing is for sure that its transmissibility is much worse than any of the previous variants that we've seen, including the Beta. As far as disease severity, we don't know if it actually causes a more serious picture. There are anecdotal evidence of people saying that it's quicker, people get sicker much quicker, the children can get it, and so on. But there's no clear evidence of major differences. The risk of reinfection, if you've already had the Beta or the Alpha or any of the other variants, is still there. So you can be reinfected with the Delta variant. So after all this bad news, there is some good news, is that the vaccine still is protective of humans against the Delta variant. And in fact, all the variants, the vaccine works exceptionally well against. Just quickly to show you, this is really what's happening across the world. If you look at one of these graphs, let's say France, you can see this is from April, May, June. As the months progress, the red is the Delta variant coming in. And you can see with a lot of these countries across the world, the Delta variant is becoming the predominant one. So in South Africa, we see towards the end of July that the Delta variant is approximately 95% of all the viruses sequenced by the National Institute for Occupational Disease. So what are the symptoms of COVID? And I think you all know these. This is what you have to check yourself every day, every morning before leaving the house, before going to work. The cough, the loss of smell or taste, becoming less prominent with the Delta virus, fatigue or tiredness, fever or chills, body aches, headaches, sore throat, gastrointestinal symptoms like nausea, vomiting, and diarrhea, red eyes, shortness of breath, and weakness. And again, with the Delta, we're seeing something we didn't see previously with the other variants, and that is the runny nose and the symptoms of sinusitis. So the clinical presentation of COVID, we have a huge population who are infected, but who are asymptomatic. And these are the ones where it's easily spread to people because they don't know that they have it. Then you've got a group of people who will have mild symptoms and they'll be able to manage their disease at home. A group of people will need to be hospitalized, they'll need oxygen and they'll need support. And a group of people will need to be ventilated, so they'll need to go into intensive care. And some of those people will eventually pass away, very sadly. So what drives from being asymptomatic to ending up in hospital, in ICU, or dying is your comorbidities or your risk factors. And as I said, the comorbidities are high blood pressure, diabetes, asthma, or any lung diseases, people on cancer therapy. The risk factors include age, if you are overweight, and also in the later stages of pregnancy, from about 28 weeks of pregnancy. I mentioned the long COVID or post-acute COVID-19. And this is described as persistent symptoms or delayed or long-term complications of SARS-CoV-2 beyond 4 weeks from the onset of symptoms. And it affects all the organs that you can see. It affects the lungs, the blood system, it can cause clotting, the cardiovascular system, the heart, the brain, psychiatric conditions, the endocrine, meaning your kidney, meaning your pancreas, causing diabetes, the endocrines, the kidneys, and the gastrointestinal system, as well as the skin. So you can see it's all encompassing. These are the major symptoms of long COVID. Approximately 60% of people presenting with extreme fatigue, with shortness of breath, with joint pain and chest pain, and something what we call brain fog, inability to concentrate. So it impacts on all aspects of people's lives who are unlucky enough to get post-acute COVID. It impacts their physical strength, mental health, socially, as well as in the occupational setting, where there results in absenteeism, as well as inability to do the work that people might be tasked to do. So, for example, if you work where you require strength, you may not have that strength anymore. And if you work in an area that requires concentration, that may also go. So it might be difficult to do your normal job. And it requires multidisciplinary carers, from cardiologists and pulmonologists for your lungs, to psychiatrists, to physiotherapists, occupational therapists, and so on. And this is having a huge impact on the work environment. And finally, we look at deaths. And this is really where we don't want to go, and we want to avoid all the deaths that we are seeing quite a lot of in COVID now. And here we have that they generally match the waves, slightly delayed. And in South Africa, we again, with our third wave coming down, we're seeing a downswing in the number of deaths. And these are the various countries in the rest of Southern Africa, West Africa, much lower case numbers or numbers of death, but still quite a concern. Right, so how do we break this chain of transmission? And I've divided into two sections. The one is the individual space, and the other is the public space or the public health space. And the individual, as you know, sanitizing, wearing a mask, hand washing, social distancing are really the key things that we use to prevent spread of COVID. And especially now with the Delta virus, we need to be very aware that that's much more transmissible. In the public space, in the workspace, we do screening. We make sure that if you are in an office, that there's sufficient ventilation. When somebody is diagnosed with COVID, we do contact tracing. And then anybody who is known to be a positive or to be a close contact, we do quarantine and isolation. So that's the public health space and the individual health space. And now we have a new weapon in our arsenal coming into play, and this is the vaccine. So here is Superman being vaccinated. And again, it relies on a government program to bring the vaccines into the country, but it also relies on the individuals to make the decision whether they want to be vaccinated or not. So just some general information on the types of vaccines. And I've only really referred to the two types, the mRNA and the viral vector vaccines. They work in very similar ways where genetic material is put into the vaccine, either directly in an encapsulated process which enters directly into the cell, or it's placed into what we call a viral vector, like an adenovirus, your normal flu virus, which is inactivated. And then these are put into the body, and this results in the immune system recognizing the foreign protein and responding to it and developing antibodies. And those antibodies will eventually attack the real coronavirus if it comes in. These are the two vaccine types we have in South Africa. I know in some of the African countries, there's Sinovac as well, and possibly Sputnik. But here we are using, in South Africa, we're using Pfizer and Johnson & Johnson. Pfizer is a genetic vaccine and Johnson & Johnson is a viral vector. The efficacy means how well it works. They've seen in studies that the Pfizer is 95% efficacious, whereas the Johnson & Johnson is up to 72%. But these are studies that are done as part of trials. And if you look at the real world situation, both vaccines work equally as well. The dosing recommendation, the Pfizer is 2 doses, 6 weeks apart, and in the Johnson & Johnson is 1 dose. They're both given by an intramuscular injection into the deltoid in the shoulder. And the Pfizer requires storage at -70 degrees before it's defrosted, whereas the Johnson & Johnson requires a fridge that goes down to a freezer that goes down to -20. Both of these vaccines are approved in South Africa and the USA. And we know that the Pfizer works exceptionally well against the Delta. And we're seeing the results are showing that the Johnson & Johnson is also working very well against all the variants. What are the clinical considerations? If you're pregnant, are the vaccines safe? So in the rest of the world, or certainly in the United States and the UK, they are giving vaccines throughout pregnancy. Vaccines have been shown to be safe in pregnancy. In South Africa, we are giving pregnant women the vaccine from 14 weeks. If you have a current COVID-19 infection, you need to wait until you need to wait 30 days until you get the vaccine, until you can get the vaccine. But you still need to have the vaccine. So that's the same one. If you've had a previous infection, you need to wait 30 days. And if you've had a flu vaccine or you've been traveling, you need, not that people travel anymore, but if you've had something like a yellow fever vaccine, you will need to wait again a period of time between the COVID vaccine and the flu vaccine or the yellow fever vaccine, and that must be about 2 weeks. Then we look at chronic diseases like HIV or hypertension or asthma. And if you're on this medication, is it safe to take the vaccine? So there are no diseases that you should not take the vaccine. They've been declared safe to take in with any disease. Certainly, if you have a complicated autoimmune disease, speak to your doctor. But people who have got stable HIV infections, it's absolutely recommended to have the vaccine. The vaccine doesn't have any impact on the medication, and the medication doesn't have any impact on the efficacy of the vaccine. And then the day that you're going for your vaccine, you don't need to take any medication to make sure you don't get side effects. You just go there, get your vaccine. You don't stop any of your other medication. And if you do experience side effects, you can take something like ibuprofen, brufen, or paracetamol, and so on, just to manage the side effects. Right, now looking at where we are with the global statistics. So far, there have been 4.14 billion doses administered. And you can see that's a huge amount of doses given in the world. More than 1 billion people have been vaccinated fully. 28.3% of the world have been vaccinated. And 3 vaccines have been fully approved by the United States Food and Drug Administration. So when we look at this 28.3% of the world has been vaccinated, that's quite a good figure. But sadly, when you look at the whole world and you look at specifically the African continent, you'll see that it's not such a pretty picture. And in fact, the African continent, I think it's just over 1% of the African continent has been vaccinated. So this is a picture of the world, and it shows the darker colors show the higher number of doses per 100 people, taken from July, end of July. And you can see Canada, the United States, Brazil and Argentina, Chile, Mongolia and China and Europe have got very high rates of vaccination, whereas Africa, as I said, looks very, very pale. But as I do these talks, it does start to get darker, so I think that is quite encouraging. But we cannot have some countries in the world vaccinated and some countries not vaccinated. In order to get rid of the epidemic, we need to actually equally have manage the virus spread. So until Africa actually joins the rest of the world, we're not really going to conquer the epidemic. Right, so just very briefly in South Africa, we had a plan to roll out the vaccinations starting in about January, February at the beginning of this year. The plan is to get what we call population herd immunity. And this herd immunity refers to having a sufficient number of people immunized so that they protect the people who aren't immunized. And this is thought to be achieved through vaccinating about 40 million of South African people, about 68% of the South African population. In the UK, we're seeing now with the Delta virus and being so transmissible that they're looking at actually saying that this number is not sufficient for the Delta virus, that we actually need to go up to about 80 to 90% to ensure herd immunity. So I won't go through this now quickly, but we have our healthcare workers vaccinated in the first phase. We're now moving on to the over 35s. We started with the over 60s, then the over 35s, and by the 1st of September, we're going to start with the over 18s. So where are we in South Africa? This is from yesterday. We've administered about 7.5 million vaccine doses, and 7.6% of South Africans have received at least one dose. And we're looking at about 2.84 million of South Africans vaccinated. And here you can see a picture in South Africa, comparing Botswana, Kenya, Mozambique, Uganda, Nigeria, and Ghana, and seeing where everybody is in their vaccination program and the vaccination rollout. And this is looking at the doses administered per 100 people. Right, so what is the cost? We know that nobody has to pay individually, certainly in South Africa, and I presume it's in the other African countries as well. You don't have to pay. This is covered by your prescribed minimum benefits if you are on a medical aid. And if you're not on a medical aid, it will be covered by the government. And these are the approximate prices for the vaccines. It's about 700 Rand for the 2 Pfizer and 330 for the Johnson & Johnson. And then there's an administrative fee of 70 Rand. Right, moving on to the side effects. What are the side effects of the vaccine? We get local side effects and we get systemic side effects. The local side effects occur at the site of the injection, and these will include things like pain, redness, and swelling. And these last really for 24 to 48 hours, and then they fade away. And these can be managed by taking paracetamol, what we call antipyretics, which take away fever or take away pain. Then you get the systemic side effects, and these are also very common and include tiredness, headache, muscle pain, chills, fever, and nausea. And again, lasting 24 to 48 hours, most of the time. They may last 1 or 2 days longer. And these again can be treated with Panado, Brufen, aspirin, and so on. We know that these side effects are limited, and they really don't last beyond 24 to 48 hours. That's a known. What's not a known is if you are exposed to somebody with COVID, you don't know if you're going to get COVID. You don't know if you're going to get mild symptoms, severe symptoms, end up in hospital, end up on a ventilator, or end up passing away from COVID. So this is a known. Exposing yourself to or being exposed to COVID in the environment is an unknown. The other side effect of concern is anaphylaxis, or a severe allergic reaction. This, I would add, is very uncommon, but it does occur and it needs to be monitored. So at any vaccination site, there will be paramedics or medics or nurses or doctors to look after people for approximately 15 minutes until this time that you will get the anaphylaxis or the allergic reaction to be over. So I said it is very uncommon, but because it does occur, we take extreme caution to make sure that nobody is left untreated. With the Johnson & Johnson vaccine or the AstraZeneca vaccine, the adenovirus vaccines, there was a concern about clotting. And for this reason, they found that a number of people, a few people, developed clots following the vaccine. And the vaccine rollout for Johnson & Johnson was halted both in America and in South Africa so they could look at the data. And when they looked at the data, they found that there were approximately 6 people per 6.8 million who developed a clot due to the Johnson & Johnson vaccine. When this is compared to the general population, the risk of getting a clot in the general population is between 3 to 15 per million. So the Johnson & Johnson actually is the same as the general population. However, if you do get COVID, your risk increases by up to 66 times. In pregnancy, it increases by up to 39 times. And using the oral contraceptive pill, it can increase up to 132 times. So in fact, the risk of getting a clot following the Johnson & Johnson is very similar to what it would be in the general population. Because we know that it may be a risk, people who have the vaccine are advised about it, and they, if they have any symptoms, will need to consult their doctor, and it can be managed. So the next thing we need to look at is the long-term side effects. What are the long-term side effects of a COVID-19 vaccine? So we can say we don't know because COVID has only been around for a short period of time, and vaccines have been around for an even shorter period of time. Probably we're looking at 9 to 10 months if we include the trials, maybe a bit longer. So we don't know exactly what COVID vaccines do, but we do know we've had vaccines for many, many years. In fact, the first vaccine was discovered by Edward Jenner in 1789, the smallpox vaccine. And through that, and since then, smallpox has been completely eradicated from the world. And secondly, we now have about 17 different vaccines that we offer in childhood and to travelers. And we know that there are very few long-term side effects. So we can assume, because it's very similar technology, that there are no real concerning side effects to the vaccine. Right, so are they safe? So we look at regulatory bodies. There are very strict protections in place to help ensure that the safety of all COVID-19 vaccines. So before receiving any validation from the World Health Organization and national regulatory agencies, and in South Africa we have the SAPRA, COVID-19 vaccines must undergo rigorous testing in clinical trials to prove that they meet internationally agreed benchmarks for safety and efficacy. We also know that there's strict monitoring. So WHO and other regulatory authorities will continuously monitor the use of COVID-19 vaccines to identify and respond to any safety issues that might arise. And through this process, they'll ensure that they remain safe for use around the world. There's been a lot of talk about the mRNA or the genetic vaccines, like the Pfizer vaccine and the Moderna vaccine, that they're new vaccines. But in fact, this technology has been rigorously assessed for safety, and all clinical trials have shown that it produces an immune response, and it works very, very well against disease. And in fact, these mRNA vaccines were not such a new technology, and they've been studied for several decades, including when the Zika outbreaks, the rabies, and some of the influenza vaccines. They aren't a live virus, a vaccine, and they don't interfere at all with the human DNA. And I'm now moving on to look at the impact of the COVID-19 vaccination programs, both globally and in South Africa, and we see that there are some compelling arguments. Right, you'll start to recognize my slides. This is a share of people who received at least one dose of COVID-19 vaccines in the world. And I'd like to draw your attention to Canada, the United Kingdom, and Israel. Here we are in South Africa, kind of getting along. If you look at Israel, they started towards the end of December 2020. By February, they had covered about 60% of their population. And then slowly they've gone up to about 65% of their population. If we look at the United States, they've also been going from the end of last year, and they've come up to 50% of their population. If we look at the United Kingdom, if we look at Canada, Canada started off very slowly, but then has exceeded anybody else and is now at about 70% of their population. And the United Kingdom is somewhere in between. Right, so what I'd like to show you here is the weekly new hospital admissions for COVID-19 in Israel. Again, taken from this Our World in Data site, which really gives daily stats. It's a very interesting site to keep an eye on. So here they started their vaccination programs. These were their waves where they had hospital admissions. And you can see from February, when they had about 60% of their population vaccinated, you started to see a decline in the number of hospital admissions. And the picture is very similar in their ICU admissions. We're seeing now this increase in hospital admissions, and this is due to the Delta virus, and it's in the unvaccinated people. Now, this screen looks at comparing South Africa to the United Kingdom, and it looks at the daily cases, the daily deaths, and the total vaccine doses. So here in South Africa, you will have recognized the South African typical 3 waves that is now going down. And this is our death rate due to COVID, which has increased accordingly with as the 3rd wave has advanced, the death rate has started to go up. And you can see our vaccination program only really started kicking off quite late. This is the United Kingdom. They've had a couple of little blips and then some huge wave earlier on last year. And now they're seeing, again, due to the Delta wave, an increase in the number of cases of COVID. But if you look at their death rate, it actually remained quite flat. And if you look at the vaccination program, you can see they're starting to achieve a good coverage, which is resulting in the flattening of the death rate curve. And looking at the other way around, this is the COVID-19 vaccine rollout in Canada, in Alberta, which is a state of Canada. looking at the ICU admissions and who isn't hasn't had the vaccine. So you see the green people are fully vaccinated. Purple refer to the ones who've had 2 doses, but it's less than 14 days since their last dose. The dark blue is the 1 dose. The light blue is the 1 dose, less than 14 days. And the red is the unvaccinated. And you can see, if you look very, very carefully, I think there was a case there and a case there of the green, where people were fully vaccinated, but it did end up in ICU. So it's not impossible. But if you look at the vast majority of people who end up in ICU are the unvaccinated. And in fact, this is a CDC report, Center for Disease Control from the United States, which came out towards the end of June, looking at the hospitalizations and deaths due to COVID. And they show that 96.4% of hospitalizations in the United States are now in unvaccinated people. And the figure given then was 99.2% of deaths are in unvaccinated people. And I saw that Dr. Fauci on CNN was saying yesterday that it's actually gone up to 99.9% of deaths are in unvaccinated people. So finally, I want to just talk about misinformation and countering misinformation. This is a poster taken from the European Center for Disease Control, and it looks at misinformation and what it can do to a vaccine rollout program in a country. It leads to increased vaccine hesitancy and reduced vaccine uptake. And the countries that, where this is happening, governments and countries and their health programs have to counter the misinformation. So they need to monitor what's going on in social media. They need to correct the misinformation. They need to provide proper, true information as well. And then they have to evaluate this whole process to make sure that the vaccination program is not disrupted by misinformation. So where do we find misinformation? And this is very easily spread these days on social media. The Twitters, the Facebooks, the WhatsApps, the TikToks, the YouTubes, which gets transmitted so easily. You can just share to all contacts, and misinformation can easily be spread in this way. So I'm really encouraging people to go to the websites like the ones that are accredited websites, like the CDC, which is the Center for Disease Control in America. There's one for Canada. In fact, every country has their own website. The WHO, the World Health Organization, has excellent information. And so too in South Africa, we have our own COVID-19 SA coronavirus website where we can get excellent information on vaccines and COVID. Right, so that's the end of my talk. I hope you found it of value. We now can open to questions.
Thank you, Dr. Sapphire. We look forward to hearing the information that you've really given us today. And it's given us an opportunity to we were looking forward to getting the information, and it's given us a full picture around the pandemic as well as the vaccine. And I've seen we've got a couple of questions in the Q&A section and also on our chat section. I don't know if you've got line of sight of that from your side.
I don't. I think I'm going to have to stop sharing to be able to see the questions, possibly.
No problem.
Or maybe no, I can try and see.
I'll give you some time to stop
sharing.
I'm
all good. I can see.
On your side, wonderful. So there's some Q&A as well as some questions on the chat side as well.
Okay, shall I start with the Q&A?
Yes, please.
So Nicole is asking, are there symptoms after taking the vaccine? Yes, there most definitely are, and I did allude to them. At the site of the vaccine, you will get pain, swelling, and redness, which does go away. And then people feel tired, exhausted. They might get chills, they might get fever. And this is actually a sign of showing that the vaccine is working and it's stimulating the immune response. So you mustn't worry about that. And you know that in 1 or 2 or 3 days, it will all be over and you'll be back to normal. And Natalie's asking, if you fall ill with a general cold after your vaccine, is it safe to take ibuprofen or paracetamol? Also, if you think you have COVID, how soon after vaccination can you have a COVID test? Right, so if you fall ill with a general cold, yes, it is safe to take ibuprofen or paracetamol. 100% you can do that. And if you think you have COVID, how soon after your vaccination? You can have it. If you've got symptoms, you need to take a COVID test. So really, if you have any symptoms of COVID, please do a COVID test. If it's a positive test, it means that you have COVID, because the vaccine won't cause a positive COVID test itself. Then Glenn is asking, how does the virus cause so much damage to the human body? What are the biological processes that take place? Well, this is a very complicated question. I don't know if we've got time to answer it in full, but there are a couple of things that it does. It causes, what we're thinking is the damage is caused because it does affect the vascular system. So when it does that to the lungs, it can cause a lung pneumonia. It can cause clotting. It can cause damage to the heart muscle. It's caused by what we call a hyperimmune response. The body actually reacts to the COVID. It has an overwhelming immune response, which then actually ends up damaging the body. But that's quite a complicated question. I don't know if I can fully answer it here. Then an anonymous attendee asks, I have just been diagnosed with high blood pressure and have been on medication for a week. Doctor recommended me not to get the vaccine. Well, I'm not sure if he recommended not at all, or just while you are getting used to your medication. I think hypertension, we know, is a risk factor for severe COVID. So you definitely need to get the vaccine. I'm not sure if you need to even wait for any time between now and I'm not sure how long he wanted you to wait. You do need to get the vaccine. Right, then Leslie's asking, I've had my first vaccination, now started with bad sinusitis and runny nose. I'm due for my second vax on about the 18th of August. What should I do? I'm able to concentrate, just rest more and take the usual vitamins D and zinc. I think if you've got symptoms, you need to test. There's no question about that. And if you've got a bad sinusitis and runny nose, I would test, because you need to then wait 30 days if you are positive before you get the next vaccine. And then yes.
I'd like to add some questions from the chat side just so that we can balance them out. I'll read them out to you. I've got a question from Anonymous here, which says, are there any risks with regards to fertility? And should somebody wanting to fall pregnant rather have the Pfizer vaccine?
So the studies have shown that there is no risk to infertility. So you can go and get the vaccine. I don't know if either the Johnson & Johnson or the Pfizer vaccine will make any difference, but the studies have shown definitely that it doesn't have any impact on fertility or infertility.
And then another question, is it safe to have the vaccine if I've just started taking ivermectin?
I think you need to take the vaccine. I'm not going to comment on the ivermectin, but yes, you can have the vaccine. You should have the vaccine.
Okay, we've got another question. Can the vaccination lead to any deaths?
Can it lead to death?
Yes.
So there have been deaths following the vaccination, but it's unclear what the connection is. If it's been the vaccination that's been directly associated with the death. So I think more data needs to be established and studied, and to make sure that they aren't that it doesn't cause death. But there normally are other associated factors that have resulted in death, where there has been death after the vaccination.
One last question from the chat from my side, and then we can go back to the Q&As. Good day, doctor. I've developed a big lump-like formation literally overnight after my vaccine. It was said to be apparently a gland caused by my lymph nodes. Is this something of concern to be reported, 1 second, to the vaccine center? Question mark.
I don't know where the lump is. So what sometimes happens is when you do get an infection or you do get some kind of assault on the human body, your body reacts and clears up the infection. And this is done through the lymph system. And sometimes you will get a gland, an enlarged gland, as a result of a local infection. So this is possibly what could have happened. I don't know where the lump is. I would imagine if you've had the vaccine in your arm, it would probably be in your neck somewhere there. I wouldn't worry too much about it. I would watch it, and if it doesn't go away, then to consult your doctor, and if he's worried about it, then he can report it. But that isn't actually one of the concerning side effects from the vaccine.
No problem. I think the last question on the Q&As was from Leslie. Then you've got Anonymous as your next one on your side.
Okay, so Anonymous, what do you do when you get a positive in between your first and second jab? Do you wait until you'll be allowed to get vaccinated once you're well? So yes, so you have to wait 30 days. So let's say you have your first vaccine and then you get COVID. You wait 30 days from the time of your diagnosis, from your positive test, and then you can get vaccinated. And it is recommended to get vaccinated the second time, even if you've had COVID in between. The illness can actually act as a booster, and then the second vaccine will act as another booster. But yes, you do need to have both vaccines. And then Anonymous asks, is it true if the employees who will not be allowed to work if they choose not to vaccinate? No, so I think there's no truth to that. I think people at this stage have got a chance to decide whether they want to vaccinate themselves. And what I would say is that people need to educate themselves and come to the right decision.
I've got a question from the chat box. Is it possible for your blood pressure to increase slightly after the first vaccination?
Well, so blood pressure does generally go up and down. It's possible that your body is mounting an immune reaction and may have a fluctuation of going up and down while it's accommodating to the vaccine, but I don't think it's of anything to worry about.
Wonderful, Doctor. We've got space for one more question and then we'll need to wrap up, unfortunately.
Okay. Does it matter which vaccine you take, 1 dose or 2 doses? I'm not sure what's being asked there. It doesn't matter what vaccine you take, whatever vaccine is being offered. Certainly in the countries that you are in, they will have been approved by your country. It doesn't matter. The Johnson & Johnson requires 1 dose and the Pfizer requires 2 doses. As long as you take the vaccine according to the requirements, it doesn't really matter. You'll be protected in whichever way.
One question from my side, one last question from the chat box. Do you need to keep vaccinating every 14 days in order to build immunity against COVID-19?
No, you need the 1 Johnson & Johnson or the 2 Pfizer vaccines, which are 6 weeks apart, and that will keep you immune. Long term, we don't know. It's possible that boosters may be required, but at the moment, we're not really even certainly in Africa, we're not even talking about our booster vaccines because we're still on our first vaccines. The last question: what if you're not aware of you've had COVID and get vaccinated? That's not a problem. It's not going to. It might, your body might be less primed to form as good an immune reaction, but it will do that. So it doesn't really matter. You don't need to worry about that. Yeah.
I think we've covered most of the questions on the chat side. I don't think we've missed anything on the Q&A side either. And that's all from just double checking the chat box if we've missed anything. And the question regarding the big lump-like formation, it was in the underarm, Doctor. Just
underarm. Okay. Yeah. So it's probably unrelated to the vaccine in that case.
So that was in response you had asked where the growth was forming.
Okay. No, thank you. And I see somebody was asking if you're breastfeeding, can you vaccinate? Yes, it's safe to vaccinate when you're breastfeeding.
Thank you. I think in conclusion to all of those questions, those rapid fire questions, thank you so much for answering them and answering them so well. And I'd like to extend a big broad thank you to you, Dr. Sapphire, for your time and your patience with us today, this afternoon. And we really appreciate all of the information you've shared with us today. It's definitely food for thought. And I think we all feel empowered. We've learned a lot today. And I think we can all go away, whether we go to our health practitioner, our local clinics, but just to get we have the right amount of information to now make an informed decision whether to vaccinate or not. And just a reminder to all of our brollies that we have our next session of the course series next week, Tuesday, same time and same place. And if you have missed out on any of the other 3 series that we've had, you are welcome to contact us at brolcares@brol.com, and we'll be happy to share these with you. Have a wonderful afternoon. Thank you so much. Bye.
Thank you.
Bye.
Bye.